Tree man. Epidermodysplasia, verruciformis syndrome, turns the skin into bark-like formations. Caused by a genetic mutation and the human papillomavirus, it triggers uncontrollable warty growths. Imagine branches growing on your hands, making it hard to move your fingers or hold objects easily. Living like this means facing curious stares and struggling with daily tasks like buttoning a shirt or writing. Surgery can reduce the growths, but they often return, requiring constant interventions. Patients often feel isolated, as society tends to judge their appearance. Yet many find strength in communities that accept them without prejudice. Sometimes the body decides to be its own sculptor, even if no one asked for the artwork. Water allergy. Aquagenic urticaria causes painful, intense welts upon contact with water. Whether it's rain, sweat, or a shower, the skin reacts with unbearable itching. Imagine washing your face and feeling it burn as if it were corrosive acid. These people face each day with anxiety, knowing water is everywhere. Even drinking water can trigger mild symptoms in the mouth or throat. Wet clothing or environmental humidity are constant threats in their routine. Many use protective creams or avoid outdoor activities to minimize pain. Ironic, isn't it? The element of life becomes their worst enemy. Glass bones. Osteogenesis imperfecta causes bones to break with the slightest physical impact. A strong sneeze or a hug can fracture ribs or arms without warning. It's like living in a body made of fine porcelain, always on the verge of total collapse. Physical fragility doesn't define their spirit. Many develop astonishing resilience daily. Physical therapies and orthopedic supports are essential for their daily mobility. Even so, simple activities like walking or sitting carry significant risks. The medical community is working on treatments to strengthen their bones, but there's no cure. Walking with extreme care is their routine, but not their limit. Absolute photographic memory. Highly superior autobiographical memory syndrome allows recalling every detail of one's life. A person with this can tell you what they ate on a Tuesday 10 years ago exactly. Imagine reliving every conversation, every mistake, as if it happened yesterday, without pause. Living with this gift is both a blessing and a burden. The past never fades. These people can recite dialogues verbatim or describe smells from distant events. However, painful memories also remain vivid, causing emotional distress. Some use their memory for professions like historians or writers, excelling. Forgetting is sometimes freedom, but they don't have that option. Pain insensitivity. Congenital insensitivity to pain prevents feeling any physical discomfort. A cut, burn, or fracture goes unnoticed without warning signs. Imagine breaking your foot and continuing to walk without realizing the internal damage. While it sounds useful, the constant danger forces them to check themselves like machines. Parents of children with this condition live on alert, fearing undetected injuries. Infections or internal damage can worsen without pain as a warning signal. Life requires frequent medical checkups to ensure physical safety. Without pain, the body keeps its secrets until it's too late. Werewolf. Hypertrichosis syndrome causes excessive hair growth all over the body. Even the face can be covered in hair, like a permanent, uncontrollable costume. It's like waking up every day looking like a character from a fantasy tale or myth. Many face rejection, but others embrace their uniqueness with fierce, singular pride. Shaving isn't always enough, as the hair grows back quickly and thickly. Some opt for laser hair removal, though results vary from person to person. Self-esteem plays a key role in living confidently despite the stares. Society judges appearance, but they prove character matters more. Body that doesn't age. Highlander syndrome halts physical aging in childhood or adolescence. The body stays young, while the mind matures normally, creating a contrast. Imagine being 30 but looking 12 in every photo or social encounter. Living like this is being trapped between two worlds, young on the outside, adult on the inside. Social interactions are complicated. People often underestimate their maturity. Finding a job or a partner can be challenging due to external perceptions. Medical research still doesn't fully understand this rare genetic condition. Eternal youth sounds nice until you're asked for ID at every door. Voices in the head. Musical hallucination disorder makes the brain play music non-stop. No earphones or radio. The melody comes from within, sometimes for hours on end. It's like having a band playing in your mind with no pause or control button. Some enjoy it. Others struggle for the silence that never comes to their mind. The songs can range from familiar classics to invented melodies. Stress or fatigue often intensify these uncontrollable auditory hallucinations. Therapy and medication help some reduce the frequency of episodes. The brain is a whimsical musician that doesn't always take criticism. Blue skin. Methemoglobinemia tints the skin bluish due to high levels of methemoglobin. The blood doesn't carry oxygen properly, giving the body an almost extraterrestrial hue. Imagine looking in the mirror and seeing a face worthy of a sci-fi movie. Living with this means facing constant curiosity, but most adapt with humor. The condition can be treated with medications like methylene blue in severe cases. However, the blue hue persists for many, marking their daily social life. Some have turned their appearance into a source of unique cultural pride. Being blue isn't just a color, it's a way of standing out without meaning to. Stone body. Progressive fibrodysplasia ossificans turns soft tissues into bone over time. An injured muscle or tendon hardens, limiting movement forever. It's like feeling your body slowly turn into a marble statue. Each day is a race against stiffness, but the will remains flexible. Minor traumas like falls accelerate the progressive ossification process. There's no cure, and surgeries often worsen additional bone formation. Patients learn to value every movement before it becomes impossible. The human spirit finds ways to shine even when the body stops. Sun allergy. Erythropoietic protoporphyria causes extreme pain upon exposure to direct sunlight. A minute under the sun can feel like second-degree burns on the skin. Imagine living in the shadows, avoiding the day as if it were an implacable enemy. These people find beauty in the night, where the world gives them a break. Protective clothing and special sunscreens are essential for their daily life. Even strong artificial light can trigger pain in more severe cases. Research seeks treatments, but the nocturnal reclusion remains common. Many patients develop nighttime routines, working or socializing under moonlight. Daytime isolation can lead to loneliness, but also creativity in their habits. Some describe the night as their refuge, where their skin finally rests peacefully. Prolonged exposure can cause liver damage due to protoporphyrin buildup. Living with this condition requires planning every outing like a strategic operation. Medical advances offer hope, but the sun remains a formidable adversary. The sun gives life, but for them, the moon is kinder. Double life. Dissociative identity disorder creates distinct identities that control behavior. Each personality has its own voice, tastes, and memories, like separate parallel lives. It's like sharing your body with strangers who take control without warning. Living like this is a constant mystery, seeking unity in a complex mental puzzle. Transitions between personalities can be triggered by stress or specific events. Therapy seeks to integrate these identities, but the process is long and challenging.
Some patients manage to coexist with their alter egos, finding a unique balance. Each personality may have distinct skills, like languages or artistic talents. For example, one identity might be outgoing and paint, while another prefers solitude. Triggers vary. A smell, a word, or a place can shift who's in charge. Those who live with it describe a sense of disconnection, like watching their life from the outside. Society often misinterprets this disorder, associating it with drama or fiction. However, for them, it's a daily reality requiring strength and self-awareness. Integration isn't always the goal. Some prefer to accept their multiple selves. Sometimes the mind decides to write multiple stories with the same protagonist. From the tree man to multiple personality.
These medical cases show how strange the human body can be. Each faces a unique challenge, but all share the strength to adapt and move forward. Medicine explains the cases, but the human spirit defines how they're faced. Subscribe if you want more stories that challenge what you thought was possible.